You may think that once the immediate danger of a stroke has passed, the worst is behind you. But as a doctor who has spent decades treating older adults, I must tell you that the real battle often begins after the hospital stay. Stroke is not just an event. It is a turning point that can silently bring long-lasting complications into your life. Many seniors survive the initial stroke, but later suffer from hidden struggles that affect the brain, the body, and the spirit. These complications can creep in quietly, making you feel weaker, more forgetful, or less independent, all while you believe recovery is complete. The truth is that unless you recognize these hidden dangers early, you risk losing the progress you have made and facing a life that is far more limited than it needs to be. In this video, I am going to reveal 7 stroke-related complications that every senior and every caregiver must watch out for. Some of them affect the brain, leading to delirium, depression, or even dementia. Others attack the body, making it harder to walk, swallow, or even speak. And some of the most silent risks, like dehydration or pressure sores, can quietly steal away independence or even life itself. But here is the good news. Each of these complications can be managed, prevented, or improved if you act quickly and wisely. By the end of this video, you will know what to look for, what to avoid, and how to protect yourself or someone you love from the hidden dangers that follow a stroke. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Now, let us begin with the first complication. One that many families mistake for simple confusion, but is actually a medical emergency. Part 1. Delirium. The silent mental storm. In the first week after a stroke, up to 40% of patients experience delirium. This is not ordinary forgetfulness. It is a sudden storm in the brain, where thinking, memory, and awareness shift rapidly. One moment, the patient may recognize you. The next, they may seem lost or unable to focus. Families often dismiss this as tiredness or stress. But delirium is a red flag that recovery is at risk. For older women and men, delirium makes hospital stays longer, slows rehabilitation, and raises the chance of death. The reason is that the brain, already injured by the stroke, becomes more vulnerable to infections, medications, or even dehydration. In my clinic, I remember an older gentleman who began seeing things that were not there just 2 days after his stroke. His family thought it was a side effect of medication, but tests revealed he had an infection worsening his confusion. With prompt treatment, his mind cleared. Without it, his recovery would have collapsed. The lesson is clear. If someone you love seems unusually confused, restless, or withdrawn after a stroke, do not wait. Alert the doctors immediately. The storm of delirium can be calmed, but only if recognized. And once that storm settles, another hidden shadow often follows depression. Part 2. Depression. The hidden weight of recovery. Nearly half of all stroke survivors experience depression, and 1 in 5 develops major depression that demands urgent treatment. The weight of depression is not just emotional, it is physical. Patients with untreated depression struggle to regain strength, lose motivation for therapy, and face a higher risk of death. The brain after a stroke undergoes chemical changes, and when combined with the loss of independence or physical abilities, it becomes fertile ground for despair. I once treated a 65-year-old woman who regained her ability to walk but no longer wished to leave her home. She felt hopeless and disconnected, and her recovery stalled. With counseling and proper medication, her spirit returned. And so did her progress. Depression is not a weakness. It is a medical condition that deserves attention. Signs include constant sadness, irritability, loss of interest in activities, or sudden changes in sleep. Caregivers must look beyond physical healing and ask, how is her spirit? How is his mood? Addressing depression early transforms recovery. And yet, even if the mood is lifted, another challenge may slowly creep in. One that affects memory and thinking itself. Part 3. Vascular dementia. The quiet thief of memory. Having one stroke doubles the risk of dementia. In some cases, memory loss appears right after the stroke. In others, it develops slowly over years. A shadow that grows darker with time. This is known as vascular dementia. The second most common type of dementia after Alzheimer's, unlike depression, which can often be reversed. Vascular dementia tends to worsen over time, robbing seniors of their independence. Families may first notice small lapses, such as forgetting names or losing track of appointments. Over time, reasoning, judgment, and even the ability to make basic decisions may fade. There is no cure, but there is management, controlling blood pressure, cholesterol, and diabetes can slow the decline. Mental exercises, supportive therapy, and a stable routine also help preserve function. I always tell families that early recognition matters. The sooner you adapt the environment and provide cognitive support, the longer the patient can enjoy meaningful interactions. But dementia is not the only way stroke steals independence. Sometimes, the very ability to stand and walk becomes fragile. Part 4. Mobility and the risk of falling. After a stroke, many patients find their legs weaker, their balance unstable, and their steps uncertain. Stroke can damage the parts of the brain that coordinate movement and vision, leaving seniors vulnerable to falls. Add in dizziness, poor eyesight, or muscle weakness, and the risk multiplies. Falls are not minor accidents. For older adults, they often lead to fractures, head injuries, and a loss of confidence that chains them indoors. Rehabilitation, including physical therapy, is essential. With guided exercises, muscles can relearn, nerves can rewire, and balance can improve. Assistive devices like walkers or canes may restore independence, but mobility is not just about the body. It is also about confidence. I recall a 72-year-old man who refused to walk after a fall in his kitchen. Through steady therapy and emotional encouragement, he regained not only his ability to walk, but also his sense of courage. The lesson is simple. Do not neglect mobility therapy. Movement is medicine. And if moving is hard, speaking may be even harder. That brings us to the next complication. Part 5. Speech and aphasia. About 1/3 of stroke survivors face aphasia, a condition where speaking, understanding, reading, or writing becomes difficult. Families often mistake this for reduced intelligence. But the truth is, the mind remains sharp. It is the pathways of communication that are damaged. Aphasia isolates seniors, leaving them frustrated and lonely. But speech therapy can rebuild these bridges. Techniques include practicing words, using gestures, or even drawing. With patience, communication returns. Though sometimes in new forms, for caregivers, the key is respect. Do not rush the patient. Do not finish their sentences. And do not raise your voice as if they cannot understand. Instead, give them time. Turn off background noise and listen. I remember a patient who could not say her daughter's name after her stroke. Through months of therapy, she learned to express love by drawing a heart and pointing. That symbol became their new language, and it held just as much meaning. But speech is not the only basic function stroke disrupts. The act of swallowing, something we take for granted, may suddenly vanish. Part 6. Swallowing and the danger of dysphagia. Up to 70% of stroke survivors struggle with swallowing. A condition known as dysphagia, food or liquid may enter the airway instead of the stomach, leading to choking, aspiration, pneumonia, or malnutrition. For older adults, this is life-threatening. A speech-language pathologist evaluates swallowing and prescribes therapy exercises, diet modifications, and sometimes nutrition supplements. I once treated a man in his 70s who lost weight rapidly after his stroke. He avoided meals out of fear of choking. With professional therapy and carefully chosen foods, he regained the strength to eat safely and even enjoy meals with his family again. The lesson here is to never ignore swallowing problems. What seems like a minor difficulty can lead to dehydration, infection, and even death. And, speaking of dehydration, that is the next silent complication that families often overlook. Part 7. Dehydration, incontinence, pressure sores, and vision loss. Older stroke survivors often fail to recognize thirst, leading to dehydration. This contributes to constipation, kidney problems, confusion, and even death. Caregivers must encourage regular fluid intake, especially for those with memory issues. Another common issue is incontinence. Up to 60% of hospitalized stroke patients leak urine, which can cause embarrassment, skin problems, and social withdrawal. With therapy and medical guidance, bladder control often improves, but it requires patience and care. Pressure sores are another hidden risk. Seniors who remain in bed too long develop skin breakdown where bone presses against mattress. Prevention is simple but requires diligence, repositioning, good nutrition, and prompt treatment of infections can prevent sores from becoming life-threatening. Finally, stroke can damage vision, leaving seniors with partial blindness or double vision. This makes daily activities more dangerous and isolating. Rehabilitation, glasses, or vision therapy can help, but awareness is essential. These complications may sound overwhelming, but understanding them is the first step to preventing them. And that brings us to the final message. I want every senior and every caregiver to remember. Doctor's final words. Surviving a stroke is only the beginning. The hidden complications that follow can steal independence, weaken the spirit, and shorten life unless you recognize and act on them quickly. Delirium, depression, dementia, mobility issues, speech problems, swallowing difficulties, dehydration, incontinence, pressure sores, and vision loss are not just medical terms. They are real struggles faced by real people every single day. But here is the truth. with awareness, therapy, and support. These complications do not have to define the rest of your life. Your brain, your body, and your spirit all have remarkable power to heal when given the chance. Recovery is not about perfection. It is about progress. It is about choosing every day to face these challenges with courage and to surround yourself with people who care. If you are a caregiver, your role is sacred. You are not just helping someone survive. You are helping them live. Share this video with someone you love so they too can recognize the hidden dangers of stroke and protect themselves. Now I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, comment 1. If not, comment 0. And do not forget to like, share, and subscribe for more content like this. Thank you for watching. And here is to living life on your own terms.